What's better, over-the-counter vitamin D or the prescription once-a-week vitamin D? My name is Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor, and let's talk about this simple question. So vitamin D is a very important vitamin. Lots and lots of research on vitamin D. It's implicated in so many different health issues, and a lot of people are deficient. It's one of the most common vitamin deficiencies. It's very easy to do a blood test and screen. Many people are checked at a regular annual physical. And then there's this question, whether to take an over-the-counter daily vitamin D that you can just buy online or in a store, or to get a prescription for the once-a-week strong high-dosage vitamin D. Is there a difference? Is there anything in research that would tell us which one is better? So the prescription kind is usually 50,000 international units, and usually it's taken once a week, right? And maybe like if it's very low, the level is very low, the initial might be like 2 pills, but then it's 1 pill once a week, ongoing, and maybe in the summertime you can take a little break. It's high dose, but in general, this type of vitamin is easy to absorb and it's fat soluble, so it stores in the body. So it's perfectly sensible to take this type of vitamin just once a week. And people who have a very serious deficiency probably should just take this one. But for most people, it's like this personal question, right? And the thing that's actually really important is, what are you more likely to stick with, right? And that's pretty much in the research, that's like the main difference, right? Because in the research studies, both work, right? If you take enough of the over-the-counter, or if you take the once a week consistently, they both work. We have more research data, of course, on the prescription kind. That one works, and it's more consistent, what people are actually taking. But I check my patients' blood levels, and the over-the-counter can work too. Sometimes, like when we repeat labs, 3 months later or 6 months later, and it's still low, then we just adjust the dose, right? And I recommend taking more. The dosages over-the-counter are super confusing though, right? Because the old, outdated recommendations when D was thought to really just be connected to rickets, are very low, right? It's like 400 IUs per day. And if you take 400 IUs per day and you have a deficiency, you are not going to get out of a deficiency, right? If you have a deficiency and you need to get out of a deficiency, you need to take a lot more than that. Probably you need to take around 4,000, 5,000 international units, or at least 2,000, but probably 2,000 is just enough to stay the same, right? So if you are deficient, you may need to take more and recheck, is it working? Where is the level, right? To adjust the dosing to make sure that whatever vitamin over the counter you're taking is actually working. Research studies show that actually people tend to be more consistent with the prescription kind. Maybe because it's once a week, maybe because in general as a society we are better at taking a pill that's prescribed by a doctor that comes from the pharmacy and is covered by insurance, right? So that is one vote for why the prescription kind might be in the big picture a better option, because it's effective in this once a week dosing, it's convenient, right? Not having to remember to do this every day. For most people, it's completely covered by insurance, and it's, clear what the dose should be, and more guaranteed that you will get out of deficiency and get to a reasonable level, and also you will not overdose, right? I have another video talking about certain vitamins which can be toxic when taken in too high doses, right? Any fat-soluble vitamin, EDAK, right? We need to be extra mindful. And I have had patients who by accident took, more than 10,000 international units a day for, you know, a few weeks, and they do get symptoms, right? So those are symptoms of hypercalcemia, various malaise symptoms, unpleasant, right? So better not to take too much. So just make sure if you take the over-the-counter, you don't go for sure no higher than 10,000, but I would recommend stick lower, more like 5,000. And of course, you need medical care and a doctor to help you with this, because ideally you would track the levels, right? So simple, inexpensive blood test. Now you can even order some tests yourself, but this should be based on blood levels, and deficiency is less than 20 and insufficiency less than 30. So you want your level above 30. And, you know, if you ask any dermatologist about whether you should try to get some vitamin D through sun exposure, the answer is no, right? So I've checked with several dermatologists, and they are pretty convincing that no, we should stick with using sunscreen. You know, sunscreen blocks the formation of vitamin D in our skin. So, you know, that's why we need to take supplements sometimes. The other important thing to keep in mind is the darker the skin tone, the more time in the sun it takes to make the same amount of vitamin D in the skin, right? So something to keep in mind also as when testing, dosing, monitoring, and thinking about sun exposure as a way to get vitamin D. So another thing, if you use the once a week form and then your levels are okay, you may be able to then switch to an over-the-counter supplement for like long-term maintenance if that is more convenient for you. Another thing to consider is that certain medical conditions, you know, malabsorption, kidney diseases, may require very close monitoring and different types of vitamin D. So if you have anything major going on with GI health and absorption or kidney health, definitely speak to a medical professional. But overall, both prescription and over-the-counter vitamin D can be helpful, can get you out of deficiency. It's just figuring out what's best for you, what's most convenient, what are you most likely to stick with, and working with a healthcare professional to monitor the treatment and to monitor the levels. Thank you for watching. All of my love.